Something about this whole healthcare conversation has been bothering me, and I just got an answer to it, so I want to share it with you. We've been hearing for a really long time that if these ACA premium tax credits aren't extended, that they're going to go up by about 75%. And then in the last week, we began to hear much higher numbers. Why did that number start to go up? Was someone just exaggerating for effect? No. So what actually happened is that KFF, which stands for the Kaiser Family Foundation, they are a nonprofit organization that analyzes healthcare costs. They just updated their numbers this week. They're now saying that if those enhanced subsidies expire at the end of this year, the average person's premiums will jump 114%, not 75%. That means, for example, going from paying $888 a year to paying $1,904. Why did the estimate get so much worse? Well, first, insurance companies raised their base premiums by 18% this year. That's a lot. And it directly hits anyone who doesn't get subsidies, which will be a lot more people if the enhanced credits, as Republicans want, expire. But here's the bigger problem, and this is where the Trump administration comes in. Trump's administration changed how they calculate what percentage of your income you have to pay for healthcare. Now, this is in the weeds, but in a second, you'll see how really relevant it is to you, because it turns out the Trump administration loves sneaky math. So in this case, what they did is they went back to a Trump-era formula that includes the massive premium spikes from 2017 and 2018. You may say, what massive premium spikes if you don't remember? Well, what happened then is that Trump sabotaged the ACA and premiums jumped 61% in 2 years. By including those spikes in their calculation, it makes your required contribution much higher. That one change made premiums 10 to 15% higher than originally estimated. Almost half of the difference between the old estimate and the new one is because Trump's administration changed the math. And here's what this actually means. A 60-year-old couple making $85,000 just over the subsidy cliff will see their yearly premiums rise by over $22,600. That's a quarter of their annual income, up from 8.5%. In some states, like Wyoming, it's even worse. Bronze plans alone would cost about 40% of your income. So it turns out this is what happened. Trump's administration sabotaged the ACA back in 2017, causing massive premium spikes. Now, they're using those same spikes to justify making your premiums even higher in 2026. This is manufactured chaos, and it is manufactured hardship for working Americans. The only way to stop it is to save those tax credits, which Republicans are still determined to block. What will happen? I guess it depends on how loud we get.